The next question, and Mr. Wenstrup, this will be directed to you, involves the Affordable Care Act. The Affordable Care Act has many provisions that increase the cost of business. Where do you stand on changing the Affordable Care Act's 30-hour work week definition under the employer mandate back to the traditional 40-hour level? And what do you think about delaying or repealing outright the employer mandate?
Well, I can tell you as a physician, I believe the Affordable Care Act, which many people call Obamacare, is bad business policy and bad medicine. The 30-hour work week, this definition under the ACA is just one example of several costly new mandates that are being inflicted upon us. And in addition, there's a $1 trillion tax increase passed on to families as well as employers, which together are hurting our economy overall in general. It's killing jobs, and it's definitely stifling medical innovation. I supported legislation in the House that would repeal the Affordable Care Act and the 30-hour work week requirement and restore the 40-hour work week requirement. Unfortunately, the Senate hasn't acted on this, which has been fairly common, and I support repealing the employer mandate entirely, and short of full repeal, voted for a one-year delay. So we need a fresh approach and an honest conversation about health care in America and the Affordable Care Act and creating patient-centered solutions. Reform should include medical liability reform, expanding health savings accounts, providing individuals the same tax benefits that businesses receive, creating expanded high-risk pools for those with pre-existing conditions, and addressing physician shortages, which has not really been addressed in this process at all, and expanding primary care access, increasing preventive medicine, getting people out of the emergency rooms, but also cutting through some of the bureaucratic red tape. And I have specific concerns about the Independent Payment Advisory Board, which will determine patients' care without ever seeing the patient. We need to inject more free market forces, more transparency. We will continue with our safety nets, take care of pre-existing conditions, but more so we want to increase preventive medicine so that individuals can have good, healthy outcomes and reduce costs.
You told me to call you Mr. T, and I'm just not comfortable doing that. So, Tyszkiewicz, I'll restate the question just because of the length of it. Where do you stand on changing the ECA's 30-hour work week definition under the employer mandate back to a traditional 40-hour level? And where do you stand with regard to delaying or repealing outright the employer mandate?
So let's talk about the employer mandate and why it's there in the first place. Now, the lawmakers, when they drafted the ACA, they worried that employers, once the health exchanges went online, would dump their health plans and force their employees into these exchanges. So they created this employer mandate to counteract that. I went on the record at the beginning of the campaign a year ago that I didn't think the employer mandate was necessary because we've created free market pressures on the individuals, on healthy individuals, to get coverage through tax incentives and tax penalties. So as the economy improves, they said businesses would want to continue to provide the health plans to attract the best workers. So that's what I went on the record a year ago. In May, the Urban Institute, a nonpartisan group, did a study that says, hey, the health exchanges are online, employers aren't dropping their health insurance plans. It appears the employer mandate doesn't provide material, doesn't increase coverage materially. So I support repealing the employer mandate. Now I think the ACA, there's other steps we can do, and the next step I would do is create more transparency, more free market pressure. So think about what other goods and services you buy, whether you're getting an oil change, you're buying a meal, buying a house, you know exactly how much it's going to cost before you make that purchase. Healthcare is the only thing that's not like that. When you go see a doctor, you don't know how much it's going to cost you. You don't know what the lab is going to cost. You're done talking to the doctor, he fills in some codes on a sheet, he goes off to the insurance company. You don't know how they're going to interpret those codes. A few months later, you get a bill. And guess what? More often than not, it's more than you think you owe. So what I support is free market transparency, so you know what the doctor, what the insurance company is going to charge you ahead of time, so then you can make decisions. You can do some comparison shopping. When you put that free market choice in there, people are going to make informed decisions. That's going to drive down the cost of health insurance further.